Ladies and gentlemen, it's with a great pleasure that we introduce you a distinct figure in the world of oral surgery today, Dr. Shakti Singh Deora sir. Sir is just not a renowned head and neck cancer and microvascular reconstructive surgeon, but he's also an leader in his field with extensive journey spanning over 12 years and a wealth of experience. We are delighted to have him here today. Welcome, sir. Welcome to the show, sir.
Hello, yeah, thank you. Good morning, all. Thank you for inviting me, Dr. Nathan.
Welcome to the show, sir. So, first thing first, to start with, could you tell us about your early life and what inspired you to pursue career in dental field, basically, particularly head and neck surgery?
Okay, so see, I come from a military background where my father is and retired from army, and I did my schooling from army. And my first motto was, to get into the armed forces and serve the nation. But my destiny has probably something else for me. And when I was preparing for my National Defense Academy exam, and I couldn't get to the interview, at the same time, I got the opportunity to choose dentistry, and I think that is how I went into dentistry as the subject.
Well, sir, and how about your oral surgery part? Matlab, you could have done masters into prostho, you could have done into ortho, you could have done into endo, but why oral surgery, sir?
So when I was in my third year in my clinical practice, I think that's where I got my inspiration into the oral surgery. And right in the beginning of my career of dentistry, in my third year, I've decided that I will be doing my masters only in oral surgery. That was the day when I've decided because I had fallen for the way we do save the lives of the patient. I think that has ignited my passion towards maxillofacial surgery. Secondly, maxillofacial surgery is just not a subject; it's a very vast thing, which it covers the vast topics wherein you can serve the people. So it is a never-ending subject. If I say it's not limited to one particular segment. So I think that's where I had decided to take up maxillofacial surgery and face the challenge.
Wow, sir, that's great to hear that. I won't be wrong if I say that oral surgery was your passion and you pursued your passion, right, sir?
Correct.
So
I'll tell you a small story. Sorry to interrupt. I'll tell you a small story. See, when I was in my internship, I was preparing for my final examination. I mean, the postgraduate examination. So we had joined one guidance classes wherein there's a one person by Dr. Jagdish used to guide us. So it was around 1 year of our that program was there. So on the day one when we have joined, so he asked us to write a 30 seconds. You write about why you have joined this institute, why you need guidance. So I think that 30 seconds, what I have written, it was pasted on the notice board after 1 year. Because I was so focused in that 30 seconds, I have written in my clear words that I want to do my master's in maxillofacial surgery in 2006 under Dr. S.V. Kumarsamy from the KIMS Hospital or VS Dental College. So I was so focused in my mind that I have to do only this thing under whom, under which college. So my guide was very surprised to read after reading everybody's note. He was very surprised and he said one thing. I do not know about how many people you are going to get the masters from you people, you bunch of, we had around 70 people in our batch. But I can assure you that this person who has written this, he will surely get masters in maxillofacial surgery. So that is the focus, that is the dedication you need when you want to pursue some field. So I this just story came to my mind when I was preparing for my master's program.
Wow. And that's great to hear that you are very much focused. You have been focused since the beginning. Your
Right.
career path has been truly remarkable. Could you share some highlights of your professional journey, including your training and international experiences, sir?
Okay, so see, when I finished my master's in maxillofacial surgery in 2009, I really had opportunity to serve. I did from Bangalore, that's from Rajiv Gandhi University. So I had opportunity to work in Bangalore, as Bangalore was my second home, from where I did my schooling. I did my undergraduation and masters from the same city. But I think somewhere the emotional touch has pushed me to come to my native place, that is in Rajasthan. So my parents, I always been in the hostel, and I was away from my parents for a long time. So then I've decided that I don't want to stay for longer now. I would like to spend my days with my parents. So that was the ignition wherein I shifted my base from Bangalore to Rajasthan, and I started working in Rajasthan. So I joined the government medical college as senior resident, and later I got an opportunity to work as assistant professor in one of the medical college in Rajasthan, Jodhpur, that is Dr. S. N. Medical College. And I started my career with S. N. Medical College as a maxillofacial surgeon. That was a good platform for me because it's a government setup and there was no other maxillofacial surgeon. It is interesting. You should know that when I joined in 2009 at a government medical college, there was only two people across Jodhpur, or I can say there was only two maxillofacial surgeons in that whole vicinity of Jodhpur region. So we had a good opportunity to work, and that's where I'm thankful to God and wishes of my parents that I got that opportunity and we started working full fledged. But when I was working in medical college, one of the important thing I've realized is there is forget about maxillofacial. There's a whole lack of oral cancer surgeons in our country. As I was surprised that there was no qualified oral cancer surgeon in that Rajasthan has got very few handful of surgeons who are treating oral cancer. If you go through the data, the prevalence of oral cancer in our country, it always, in today's time also, it is showing the increasing trend of oral cancer. So what we have to do, how we can contribute towards this. So that is where my inspiration came from my patients who were not treated aptly when I was in a medical college. Because I think it needs good dedication, it needs good training, and the people were not getting the expected results. Because of that, I think people were losing faith in medical sciences कि हमको तो ऑपरेशन कराना ही नहीं है, and that is where that again was one of the factor where I was more inclined for oncology. As my boss, Dr. S.V. Kumarswamy, he was an oral oncosurgeon, and he was a very reputed oral oncosurgeon. He was with the Cancer Institute, so his inspiration was there definitely. But this, my patients in Jodhpur have ignited me to pursue this. And again, I'm thankful to God that I got the opportunity to pursue my fellowship program in head and neck oncology from from Mahavir Cancer Sansthan, Patna. Now, again, it's a small story which is associated with this kind of program. The person who was working with Mahavir Cancer Sansthan, Dr. Anjanaya Dubey, was a good friend of mine. We were knowing each other since our UG days, did our PG days. He was a 1 year senior to me. And he pushed me कि यार शक्ति तो एक बार पटना, I think you should get trained into oncology. तू एक बार पटना. I went to see the environment of Patna just to meet him, spend some time for around 7-10 days with him. And I think that 7-10 days when I was with him, I continued for 1 month. And then I came to Jodhpur. I have taken the drastic step of resigning from my government job. I said, I'm not going to pursue this. It was difficult for my family. It was difficult as a professional, but I have taken that step that no, I want to get trained into head and neck oncology. And that opportunity came to me. I went to Patna, did my training of head neck oncology from Mahavir Cancer Sansthan, Patna. And even when you go through these phases, when you walk through the path, your opportunities opens up. When I finished my training, I had an opportunity as my mentor, Dr. Ravi Dev, have always inspired me. He had pushed me to still go high, So he has asked Dr. Jatin Shah to train me at his center in Memorial Salon Catering Center in New York. So on his recommendation, I worked with the stalwart of head and neck oncology, a big name, Dr. Jatin Pisha in Sloan Kettering Cancer Center, New York. And I did my training, 6 months of training in New York. Then I came back. I again worked as senior resident in the Mahavir Cancer Sansthan. And then I had shifted my base from Patna. Again, as I said, the reason was the emotional touch with my family. So I belong to Rajasthan, which is just a 3 hours drive from Ahmedabad. So I decided to shift my base to Ahmedabad. And in 2015, I came to Ahmedabad. I did my fellowship training again. I did for microvascular training from HCG Cancer Center, Ahmedabad, and then I started my full-fledged private practice. I started my career with Narayan Hardalya Multi-Specialty Hospital in Ahmedabad. Then later I had shifted my base to Apollo, and today I have my own hospital by name Northwest Cancer Hospital. And that is interesting. I'm feeling proud to say that this is the only dedicated head and neck unit in Western Rajasthan, Western India, wherein we as a team of head and neck surgeons providing dedicated head and neck services right from we have a team of neurosurgeon, we have a team of ophthalmologists, we have a team of maxillofacial surgeons, we have a team of ENT surgeons, and over that we have a team of head and neck oncology. So this is a dedicated institute of head and neck surgery by name Northwest Cancer Hospital. So this was my journey all about. And in between, I really had an opportunity to visit two more good centers. So one was the Changgung Memorial Hospital in Taiwan, wherein it was microvascular reconstructive surgery training. And that is that is known to be the mecca of reconstruction, because the people in Taiwan, the people in Korea, they have a good dexterity, and the hand-eye coordination. They are the best. So we learned the techniques of good anastomosis. We learned the good reconstructive techniques from Taiwan. And I also had an opportunity, as I was being awarded with the AOCMF fellowship program from the University of Munich in Germany. And that training has added my professional profile, my reconstructive, that increased horizon of my reconstruction, that I started doing scapula free flap in our country. We have only handful of surgeons, be it plastic surgeons or maxillofacial surgeons, who do scapula free flaps. And at one point of time, we at Narayana have done highest number of scapula flap across the country. So I'm feeling proud that God has always been great to me. With the wishes of my parents and teachers, I got what I wanted, and I am on the path of it, because it's a journey. There's no end point to this. So that's how my professional journey till now was there.
Wow, sir, it was good to hear you that you are, and your names is counted in few of the handful surgeons. Well, sir, your specialization in microvascular reconstructive surgery is truly inspirational. Could you tell us more about your work in the area and its significance in the field of head and neck surgery, sir?
See, so now there were many people in Ahmedabad also who were doing resection surgeries. So if we divide oral cancer surgeries, so we have a resection team wherein the maxillofacial surgeons, ENT surgeons, or surgical oncologists, they do the resection. But again, the reconstruction was lacking. Now, reconstruction is something which actually enhances the quality of life of these cancer patients. I tell you, 10 years back, Ahmedabad had two or three reconstructive surgeons. But now the reconstruction has taken the the driver's seat, along with resection, the reconstruction has to be done. So because every patient is now demanding, every patient, every surgeon wants to give the best of clinical services, because ultimately it is the good um, uh, faith of the patients who which inspires the doctor. So that's how we started doing learning microvascular surgery, because we had a limited field. See, we wanted to do only head and neck region. Now when we do the head and neck region, yes, we wanted to learn add on microvascular reconstructive surgery, so that we can do the best for these patients. And this again, the inspiration came from Patna, wherein Dr. Preeti, my mentor for head and neck fellowship program, and she was the one of the again I say, there was a few surgical oncologists who do this microvascular reconstructive surgeries. You can count on fingers, because no surgical oncologists want to spend time in learning microvascular and practice microvascular surgery. But the Dr. Preeti was one of the, she was a very dynamic surgeon and very inspirational mentor who has taught us to learn microvascular surgery along with head and neck reconstructive surgeries.
Wow, sir. That was great to hear that. Your dedication to your field is evident. Can you share some of your most memorable experiences or achievements in your career, sir?
See, the first thing when we talk about microvascular surgery, I will tell you. See, this is something which is beyond the limit of maxillofacial surgeon. As a maxillofacial surgeon, we have been taught to do only this much. We have been taught to practice only this much. But learning microvascular, practicing microvascular, and practicing in such medical hub was a dream for, it's like a dream for any maxillofacial surgeon. So when we started doing microvascular surgery, from I tell you, from the maxillofacial perspective, there was a lot of the opposition. I say, so when I say, when you do something interesting, whenever you do something not interesting or something out of the box, there are three stages. So first is the rejection, that whenever you are doing something out of the box, the people will reject you, people will oppose you, people will question you. And we had gone through all these three phases. The first is the phase of rejection, where yes, we have faced the phase of rejection. Second comes the phase of acceptance, कि चल ठीक है यार, he is doing good work, we accept that he is doing good work. And then comes the phase of award, or rewarding. So
Mm-hmm.
I don't know in which phase we are, but there are the three phases when we talk about out of the box things. Now I tell you, when our my seniors and we started doing maxillofacial reconstructive surgery, there was a lot of questions from the plastic surgery fraternity, that how a maxillofacial surgeon can practice microvascular surgery. And yes, this question was forwarded to Medical Council of India, which was later on forwarded to Dental Council of India. And Dental Council, as you know, they first replied, "Ki, हाँ, I think they cannot do it." But when it was questioned again with our curriculum, because our curriculum is the constitution of DCI, clearly says that a qualified maxillofacial surgeon who trained into microvascular surgery can practice microvascular surgery. And that is, the constitution says that. We have fought back with DCI, and we got a reply to the RTI filed by a few plastic surgeons, that a qualified maxillofacial surgeon can do this microvascular surgery. So I think we had this was one of the when we started doing microvascular surgery, we had a lot of opposition, but that was the phase of rejection. We accepted that. Then we came into the phase of acceptance. Now I talk about the phase of acceptance. Means when I started practicing in Ahmedabad, we were doing beautiful reconstruction. We were doing for our own patients. I was not doing for any other surgical oncologist or so. But when these people have seen our orientation, because we as a maxillofacial surgeon, we as a dental background, we have observed, right, this, we have studied this region for almost 20 years. See, the knowledge we have, focused knowledge of 20 years, which makes us, which makes us very competent to do this apt reconstruction of maxillofacial region. And my people around me, the surgical oncologists, they really have inspired, they got inspired, and they had asked me to do their reconstructive work also. And then, as I said, the phase came, the phase of acceptance, where people have then accepted that yes, they are doing a competent work. And I was doing reconstruction for, and still in today's date also, I am doing reconstruction for many surgical oncologists also. So now I don't know when we are going into the phase of reward, but I wish whatever we are doing it for the humanity, we are doing it for our patients. So that is how the microvascular reconstructive journey I can say is went on like this in our case.
Oh, wow, sir. Many of the things were very new to me that microvascular, you have fought for microvascular into dentistry. This was actually very enlightening because we as a dentist and coming towards an oral surgery department as an UG, we are taught about disimpaction, extraction, some fractures, some wiring, and our knowledge is limited to there. So, by listening to this, I hope many of the young dentists could now understand what oral surgery actually is. Thank you very much, sir, for this. Uh,
Correct. So that is the I can say, I'm not getting the word, but that is the dilemma of many of the maxillofacial surgeons. Even they do not know that we have such big horizon of maxillofacial surgery, and a qualified maxillofacial surgeon can practice these kind of head neck surgeries along with the microvascular reconstructive surgeries. I can say there are only handful of people, or there are only 30% of the dental fraternity people knows that a maxillofacial surgeon can go to such an extent. So I think your message should go loud and clear to the people of dentistry that if you want to work, you have no boundaries. Sky is the limit. If you want to get training, if you want to do something, I think we everyone have a huge potential to do that.
well said, sir. So the last question which I asked to every guest of mine, that's what advice would you give to the aspiring dental professional, especially who are interested in the field of pursuing head and neck surgery or the oral surgery part?
Right. So, I have never been to college. I have never been a good teacher. Yes, we have a fellowship program, but as such, as I said, I am totally a clinical practitioner. But I have a message for all my maxillofacial young budding maxillofacial surgeons over there. See, we do our maxillofacial surgery, and there is no actually degree after that. So don't look for just a tag of fellowship program. So I would like to give you a simple mantra that if you want to pursue maxillofacial or head neck oncology, the first thing what needed is your dedication, your time, your passion, everything you should dedicate to head neck oncology. You cannot be doing a cancer surgery in the morning, implant in the afternoon, and the impaction in the evening. So I am of the opinion that if you are doing a maxillofacial oncology or head neck oncology, stick to head neck oncology. Do your practice specifically in head neck oncology and try to learn every day. Go step by step ahead every day. The second thing is, see, you need to look for a mentor. In olden times, the people used to choose their mentor. कि मेरे को बस इसी आदमी से सीखना है, and he will be my mentor throughout my life. Do not do a fellowship program for the sake of the degree. Enough, you have done your master's course, that is the end of it. Do not do this fellowship program just to get a certificate. Do it to learn something from a person. So choose your mentor. Get dedicated to your mentor कि बस यही है सब कुछ हमको सिखाने वाला. And I tell you, 3 years or 2 years, 3 years, if you work dedicatedly with one person, you will learn many things. Because ultimately, we as a maxillofacial surgeon, we need to prove ourselves by our surgical craft, by our capability, by our the surgical hand. Because there's no other way to weigh us. It is only and only our knowledge, our surgical craft. Again, I say. So dedicate yourself to the mentor. Dedicate your time, energy, everything towards head neck oncology if you really want to pursue. Do not keep leg in two boat and try to cross the river. Otherwise, you will get distracted. You will be nowhere. So all maxillofacial colleagues, if you really want to do, take your time. Do an observership at one place. Think for 3 months whether you really want to do this. You need to understand what journey you have further. And then if you take it to your heart that yes, I'm ready to serve this, I'm ready to walk on this path. It is a bit longer path. Yes, it will have many sacrifices. If you want to do that, then come on to the field of head neck oncology. Because again, I say the India is facing dearth of head and neck cancer surgeons, and we need you. So dedicate yourself, be a good surgeon, be a good human being, and be a good doctor. So that's the message I want to give to all my youngsters, maxillofacial surgeons.
Your advice indeed was really great, sir. Thank you, sir, for sharing your inspiring journey and insights with us today. Your dedication to advancement or in the field of health and neck surgery is truly commendable, and your experiences serve as a source of motivation to many. Thank you very much, sir.
Thank you, Dr. Nathan. Thank you.
I'm your host, Dr. Ganendra. As we wrap up the session, I encourage all our listeners to connect with us on social media and keep an ear out for upcoming episodes of the MolarBear. Stay engaged, stay instigative, and continue to share your wonderful smiles with the world. Thank you for joining us today. Bye bye, and have a great day ahead.